Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Drugs that have been found to be used in uncompensated heart failure include. In uncompensated heart failure, we can use sodium potassium ATPase inhibitors, alpha blockers, and beta receptors. Beta receptor antagonists. See, beta receptor antagonists can be used, but beta agonists are not used in compensative heart failure. And what are sodium potassium ATPase inhibitors? These are actually nothing but digitalis. Okay, beta agonists are not used in compensated heart failure. See, digitalis is indicated in both acute treatment and maintenance of congestive heart failure. Next, which of the following increases the risk of digoxin toxicity? Administration of quinidine increases the risk of digoxin toxicity. Drugs which reduce the myocardial remodeling in congestive heart failure include all except carvedilol, enalapril, and spironolactone reduce the myocardial remodeling but not the digoxin.
thank you and thank you for watching.